Hi, I'm HayleySumner, and this presentation is on epistaxis. So what is epistaxis? It's just really a fancy word for a nosebleed. Usually epistaxis is very mild, but rarely it can result in surgical interventions. Epistaxis is classified as either anterior or posterior, just depending on the source. Anterior bleeds are 90% of the nosebleeds that you're going to see walk into a clinic or an ER setting, and they typically take place in where this blue circle is on the diagram here. It's called the Kiesselbach's plexus, and those are fed from the distal ends of smaller arteries. Posterior bleeds are going to take place more proximal, and they're fed by those larger arteries, even the carotid artery. So obviously those are going to result in more significant hemorrhages sometimes. And those are the patients that you're probably going to have to refer to an ENT or even the ER if you can't get it to stop. Common causes for nosebleeds are things like nose picking, especially in pediatric patients, nasal dryness, irritation, foreign bodies, any cocaine use, or facial trauma. Risk factors are going to be patients who take anticoagulants like Coumadin or Plavix, any aspirin or NSAIDs, platelet disorders, nasal carcinomas or melanomas, hypertension, alcoholism, or chronic use of steroid topical nasal sprays. Some questions we're going to ask these patients. First of all, what conditions do you have that may predispose you to this bleeding? So getting a good health history from these patients. Do you have a history of tumors or hemophilia or some kind of platelet disorder? Any trauma, surgery? Do you snort cocaine? Are you on Coumadin? Those kind of questions. Second question is the timing, frequency, and severity of epistaxis. So this helps us to determine how much blood they've already lost. So you're asking, how long has it lasted? Is this an isolated episode, or is it one of many that we might need to investigate further as to why you keep having these episodes? And then lastly, we're going to ask if they already have any other chronic medical conditions that may be exacerbated by blood loss or may mimic severe anemia. Because if they come in and they're pouring blood out of their nose and they have shortness of breath or dizziness, we need to find out, is that from the amount of blood loss that you've had from your nose, or is this because you have an underlying COPD? So we might just need to investigate a little further. So if for physical exam, first of all, we're going to assess the airway, right? We're going to make sure they're not gurgling and secretions and need to be suctioned. We're going to check mentation, vital signs to make sure that they're not having any kind of airway compromise or hypovolemic shock. We're also going to use a topical anesthetic or even epinephrine. This is just going to help vasoconstrict those tiny vessels in the nose so that you can actually see what you're looking at. Lastly, we're going to use a nasal speculum or an otoscope to adequately examine the nose. So to look at the nasal anatomy, we're looking for any lacerations, any polyps, or things like that would be caused, the nosebleed is caused by. So we're looking, is this an anterior bleed? Can we tell? Sometimes you can't tell, but a lot of times, as simple as looking like in this picture here, you can see they just use the nasal speculum, and you can see the bleed right there in the Kiesselbach's plexus. So you know this is an anterior bleed. So what are we going to do for these patients? We are going to, first of all, have them perform a basic tamponade maneuver. So we have them blow their nose really good, dislodge any clots. It's going to make them bleed worse for a second, but that's okay. They're going to apply pressure. We're not going to have them look up like this because then the blood's just going to drain down into the throat. They're going to lean forward at the waist and hold tight, constant pressure for 10 to 15 minutes at the nasal bridge where the cartilage meets the bone. 5 to 10 minutes in pediatrics. And then if that stops the blood, great. If not, you can also use Afrin spray, a couple of sprays in the nose. And if that doesn't work, you're going to move to a chemical or electrical cautery, usually chemical with silver nitrate sticks. If that doesn't work, then you move to nasal packing. This is temporary, 24 to 48 hours. The patient needs to know the importance of follow-up in 24 to 48 hours because once you meet that 72-hour mark, you run the risk of infection and tissue necrosis in the nose, dislodgements, and things like that. But you can use nasal tampons or balloon catheters to tamponade the bleeding until they can get to a specialist. And then, so we're going to teach these patients how to perform basic tamponade maneuvers. We're going to educate them to use a humidifier when the air is dry and maybe even nasal spray. And then we're going to tell them to avoid picking the nose, especially pediatric patients. Teach the moms and dads to clip the children's fingernails back so that they don't, to avoid injury. So that's just some basic highlights. Hope it helps you guys study for the test. Thanks.